Hello everyone, this is going to be my final vlog for Informatics 655 titled Patient Portal Project Plan. To start off the presentation, I wanted to define what a project charter and a management report is. A project charter is defined as a document created by a project initiator or sponsor to introduce a project and enable a project manager to allocate organizational resources to the pertaining activities. As for a project management report, that shows the progression of a project over a period of time. And so I devised a hypothetical case study that I'm going to be using throughout this presentation. Case study is listed here. With the increase of diversity in the state of Georgia, the Institute of Family Health in Georgia has decided to implement a patient portal along with their EHR system to allow patients to access their health information. In this presentation, I have divided it into two sections. The first is I'm going to discuss the portal's charter, and the second one is going to be the portal's management report. So to begin, I'm going to start off with the charter, and I'm going to list the different sections involved in the charter, and then give a brief detail about each. And so the first one is going to be overview, and it's going to give you a simple summary of why the organization wants to implement the patient portal that is interoperable with the Institute's EHR system. And so it caters over to 10,000 patients with services such as primary and urgent care. And actually, Georgia is among the top 20 most diverse states in the U.S. states. And so this institute is to care for those diverse population who are medically underserved, including homeless, uninsured, immunocompromised, and immigrants. Unfortunately, in Georgia, only 33% of hospitals have provided patients with the ability to access their health information electronically, and studies have shown that enabling patient access to these clinical information, it encourages patients' engagement in their own therapy and improves their health outcome. And so that is just a brief overview of what I put in that section for the charter. For the project team, it's going to include a multidisciplinary team, including healthcare providers, project coordinators, and Epic analysis. So Epic is the vendor organization that I decided to choose for this project. And then the stakeholders are going to include professional healthcare workers, health literacy experts, legal consultants, and so forth. The scope will include the different aspects that the project will look over, and so in scope is what we're going to focus more on in the project. So that includes the portal will be interoperable with the Institute EHR to enable accurate health information available for the patient to view, download, or transmit in their own time. Added scope is features that we can look at, but we won't be really focused on, including proxy access, including family member access to the patient's health information, of course with the patient's consent, and then favoring topics in the patient educational material. Continuing with the patient portal charter, I wanted to discuss the deliverables. And so deliverables are just results produced because of a process, and the process I wanted to mention is the development and implementation of the project will encourage the improved relationship between patients and providers. Of course, there are other outcomes, but this is the one that I thought was most important. And the project estimates. So that includes scheduling and cost. Cost will be in the next slide. Scheduling will be on this slide. I have presented onto the left side of the slide the different stages required in the project, including assessment, planning, selection, implementation, evaluation, and improvement, and then the different tasks involved in those stages, as well as the milestones, and then the time span that approximately takes for each stage. And so for example, the assessment stage, so the first stage ever, that's just to assess the workflow to determine why the organization really needs the portal. And then the milestone is just having the project team and stakeholder assigned after determining that yes, the portal will be necessary or will be important for the organization. And the time span for that is about 1 to 2 months. Here I have included the budget and cost of the different resources involved in creating the patient portal. And so for instance, security and legal compliance, that can range from $5,000 to $15,000 depending on what the organization and the vendors decide on. There are other different resources as well, including the appointment scheduling, live chat, medication refill request, incorporation of patient educational material, and miscellaneous. I didn't give a range for this one, but I said that it increases the final estimate by about 20 to 30%, which includes the alert messages, content moderation, security monitoring, and training. Then the last bit of sections that are included in the charter, I did not put into much detail on the slide, but I will talk about them a little bit. So for assumption, that's just assuming what will happen when creating this portal. And so there are two that I mentioned in my charter, including patients will need the necessary registration requirement in order to use the portal, and implementation of the portal should be easy because of the similarities between the organization's EHR. And then risk with any newly implemented technology, security and privacy is always a concern. So the Institute's risk management knows to encrypt information, implement policies for limited access to the patient's health information, consideration of the two-factor authentication, payment complies to regulatory standards, and medical staff is trained with health data security. Decision making is with the patient portal, patients and providers will have the access to the patient's health information to collaborate on the next step in the patient's care and to determine the optimal patient therapy based on the health information. And then approval is that the project will change depending on feedback and reports from the users, as well as reviews and assessments from the project and risk management teams. And with the approval of the project, patients will be more in control of their health with the ability to access their own health information through the portal. Now we're going to start on the patient portal management report. And like I said, the project management report shows the progress of a project over a period of time. And so the objectives I've listed are a few, quite a bit, actually includes improve patient engagement in their own therapies, encourage providers and patient communication via electronic messaging, and so forth. Deliverables I mentioned earlier, most of these topics are incorporated into the charter as well. So I just briefly listed them so you can see what sections are involved in my proposed management report. And so the deliverables, I said that I was going to present in later slides. So this is the slide. I have in a table the different deliverables. There are 6 here. For instance, the development of project plan and then the description of it. So project milestone and schedules are identified. And then the owner of the deliverable and then whether the status is complete or not. So for this one, it's completed because this report has been established after the implementation has occurred. And then the report also involves risk that I mentioned earlier. Continuing with the management report, it includes the schedule and milestone, as you can see on to the left. Similar table to another slide, it has different stages, tasks, milestones, and time span, except for this one it's more specific because it's a report that has been released after the project has been implemented. And so, for instance, in stages, it has assessment, and that's to determine the portable necessity and integration into the workflow, and a different task involved in that. The report also includes a WBS. WBS stands for Work Breakdown Structures, and includes stages listed in the schedule and what processes are necessary for the project to be successful and to accomplish its outcomes. And tools and techniques, the tools that I presented in my report were the EHR from the Institute, the educational resource called Medline Plus, portal access via mobile phones, computers, and then the database and security resources. Continuing with the report, we have standards. The standards just give best practice and regulations, security, privacy for the medical staff and the patients. The security and privacy policies reduce or eliminate the chances of breaches, including data breaches, thefts, and loss. The patient portal will not be a way for patients to use in an emergency event. And then here I've listed the roles and responsibilities of team members. To conclude the management report, it includes a work plan, which is seen on the right with the organizational information, and then a team contact directory with contact information from the project team member for any individuals who need to contact them, and an approval sign-off sheet that shows that the project team has concluded the project. And then here are my references. Again, these are hypothetical events for a made-up case study. Maybe one day in the future I'll be able to learn how to effectively review and write up the charter and reports. But for now, this is my attempt at being a part of a project management team. Thank you.